Yes, sir. It says, Pat. Hi, Pat. Could there be an application for skull-based pituitary case? I've seen interest in drill for these procedures. Thank you. The answer is yes, because curved, it goes back to that statement of when do we need tools? As a neurosurgeon, there are plenty of instances in the head, particularly here in the skull base and here where there's long endoscopic approaches to there. A lot of times when we're trying to drill out portions of the sphenoid sinus, of getting a larger resection of the vomer and things like that from a standard classical uh, pituitary sphenoidal approach. There has been a whole host of technologies introduced by the ENT drilling companies to help us with that. But some of these side cutting tools and things like that for standard open, mini open sphenoid approaches may very well be useful. The curved approaches to undercut the sphenoid sinus for sometimes the sinus ostia are very small. We can use them to open and resect the sinus ostia. Again, it's very nice because traditionally we've done this with keratins. We've done this with just cutting a lot of bone out and just to get a bigger hole. But having this, again, is particularly helpful at preserving stability of the nasal septum, for example, and things like that. So I'm not a skull-based surgeon anymore, but I still work with, in my hospital right here is the House Ear Institute, and they're one of the premier skull-based institutes in the world. I work with them every day, and they've leaned over and looked and thought about that. And so certainly there's a great interest in that area, and I think it's the kind of thing where you just have to go to the skull-based surgeon, lay out all the tools there on the table, and say which ones do you think will help you. And I think that's what Dr. Leckenbrink, Dr. Slattery, who are two big skull-based surgeons here in the House Ear Institute, have looked at. And so, yeah, I think there's a lot of potential interest for this for skull-based applications for neuro and ENT skull-based surgeons. But I think you'll have to, again, because I'm not I still do some brain surgery, but I'm not a regular skull-based surgeon. I think you just have to lay it out, all the tools out, and let them figure out what they can use, and it'll be just like what I talked about. It'll be a feed-forward learning process.